your joints, then that will help a lot. So it's all, I mean, I say that I'm not Jesus. I can't fix people, but I can give some tips. We have another person. Hi, Don and Ed. Haley, what time on Wednesday? Okay. Okay. Do we have to sign up? Okay. Morgan, I know you said we had more people coming. Should I wait? Should I?
Let's wait a minute and a half.
Okay.
I think it's just now 1 o'clock.
Okay, it is just.
1:02 is too late. Let's give them a minute and a half, 90 seconds,
Well,
just in case.
hi.
Yeah, here comes somebody.
Oh boy. Hello, David. And I also have my nice knee joint model right here. Show. I'm a very visual person. I like to use as much as I can. There's different learning styles of visual, audio, kinesthetic. What else is there? There's one more. Visual, audio. Oh, reading. Oh no, that's visual. Don't know. I'm pretty sure there's 4 different styles.
It's a 1:02. I think it's time to go.
Okay.
Good to go.
Okay, we're good to go. Okay, thank you guys for coming. My name is Cassie. Here, let's make sure that everyone is Ed and Sue, if you can, or if everyone can mute themselves, just so that I can stay on the picture. So, my name is Cassie. I'm a doctor of physical therapy from Body Balance, and today we are going to talk about knee osteoarthritis, which is something that I see a lot in my practice. I work with a lot of knee pain and then also hip pain, back pain. My training is in orthopedics. I'm board certified in orthopedics, so everything that I'll talk about today is mostly, or is evidence-based, or there's research behind it. So, I mean, we like to be as specific and efficient as we can in our treatment, so we're not just wasting our time and money. So, with talking about knee osteoarthritis, I like to first highlight how there's actually 2 joints in your knee. One of them is your, what you classically think of your femur and your tibia. So you can get arthritis in between these 2 joints, or between these 2 bones. But then we also have your kneecap sliding along your femur. So you can also have arthritis in between here. And that is something that an x-ray can identify, but also based off of my testing, we can kind of, I can determine where the arthritis is. This is important just in terms of certain exercises put different strains on both of these joints. So if we know that you have arthritis on your patellofemoral joint, so meaning your patella or your kneecap against your Thigh bone, I would give you a certain exercise versus what I would give for a different arthritis. Or you could have arthritis in both of them, which is also fine. But now going into what arthritis is, I like to say that it is gray hairs and wrinkles on the inside. So it's totally normal. As we get older, we expect our hair to get gray and us to get wrinkles and sunspots. And that's just kind of what happens on the inside. So along all of our joints, we have this specific type of cartilage. It's not blue, but it's articular cartilage. And what that helps is it helps the two bones like kind of slide along each other. It's kind of like a slippery surface. But as we get older, that cartilage just starts to kind of wear down, and you can have different levels of, so like it'll just kind of like thin out along the joint line, depending on where the stress is put. You might have some stress on like the medial compartment or like the inside of the knee versus the outside of the knee. And unfortunately, this cartilage doesn't grow back. So that's why if you get arthritis to the point of where it's bone on bone, you might have to get a replacement. But the good news is that we can still try to keep whatever cartilage you have healthy. And how we do this, or how we give the cartilage nutrition, is through motion. So as if you think about the cartilage, so this blue stuff, as like a sponge. If a sponge goes into water, it kind of absorbs the water and then it expands. And then if you squeeze the sponge, the water expels. So this cartilage acts like a sponge. So as you are walking or moving, you are diffusing nutrients in and out of the cartilage, which is going to keep the health of the cartilage and make your joints happy. So that applies for all of your joints with all of arthritis. But definitely it's not the end of the world if you have arthritis, because everyone has arthritis. It's just what can happen is if you're not distributing loads properly through your body, then that's where you can get pain, or like just things aren't moving together well. So risk factors, definitely if you are on your feet a lot, or if you are putting more pressure through, or like, if you have a job where you're like on and off your feet, or like bending your knees, or just putting more load through you, your genetics do have some risk factor of how much arthritis you're going to have. But also if you have had a previous knee injury, so if you've had hey Don, can you please?
Kindly call.
Thank you. If you've had a previous knee injury, so if you tore your meniscus a couple years ago, that also might cause you to have a little bit more arthritis. And then also, if you have more weight on you, so if you're overweight, that is just going to put more compressive load through your joint. But I will say that the other thing that influences the progression of arthritis is, again, if you're overweight, and then the alignment of your knee, which I'll get into, and if your quads are weak. So these are all three things that we can change, so to make the progression not happen as quickly. So going into knee alignment, if you see my little stick figures right here, sometimes you guys can see that, right? Yeah, the little stick figures, Morgan, you can see it? Yeah, they're kind of tiny. So here we go. So if someone is knock-kneed, that's going to put extra compression, thank you, that's going to kind of cause your knee to cave in a certain way, which would put more pressure through just this cartilage. Or if you're bow-legged, it might go the other direction. So if some of that might be structural, but how we can change this is through orthotics. So I'm going to back myself up and see if you guys can see my knees. Yeah? So if my hip is dropped or if my foot is caved in, that's going to influence the position of my knee. I lift this up a little bit here, like this, or vice versa. So if your hip is in a funky position, or if you have pain in your back, which causes your hip to move differently, that's going to influence the angle where those two bones are sitting together. And then same thing at the foot. If my foot is like rolled in or rolled out, that's going to change how these two bones sit with each other. So as a physical therapist, depending on whatever you come in for, whether it's your shoulder or your hip, I'm always going to be looking at, and we're going to be treating all of the joints around, just because everything moves together. So something in terms of like with the alignment, if your alignment is off, that might be something that we can address through strengthening or with orthotics. As I said, obesity, if the research supports if you lose about up to 20 pounds, you get some sort of a significant pain relief. And then what was the other one? Quad strength. So the quads are the muscle on our thigh, and it actually comes from the top of your thigh, it envelops the kneecap, and then it comes down and attaches right here onto your shin. So having strong thighs is going to help support your knee. And then I mentioned this earlier, before the presentation started, but if you are planning on getting a knee replacement, or if you know that that's in your future, there's really good evidence to support that if you have strong quads before surgery, so if the strength of your thighs if you have strong thighs before surgery, your outcomes after surgery are going to be better. So, like I said, if you know that you're about to have a knee replacement, making sure that you're strengthening your quads so that is going to give you the best outcomes. Does anyone have any questions so far? No. And I'll save time for questions at the end, or you can always put them in the chat. Where are we at? So with treatment, I mentioned weight loss, orthotics, or getting an injection. Injections are helpful for up to about 3 months. I have had some clients only get relief for maybe a week, and then some people it lasts for a long time. It's definitely, I'm more of a conservative, or I have more of a conservative treatment model in that I want to solve the problem, or we want to make sure that we are, trying to fix what the issue is. So going back to the knee alignment, if you kind of have too caved in or out of knees, that's going to cause some extra pain. If you get an injection, that might help the pain, but if we're not fixing the root cause, then after 3 months, the pain is just going to come back. So if your boat is sinking, or if you have a hole in your boat, there's 2 ways to keep it afloat. You can kind of keep shoveling the water out, or you can actually patch the hole. So if we patch the hole, that will, it's a smarter way to solve the problem. And now with all of the good stuff, or at least with what I do in terms of treatment, physical therapy, so exercise. I'm going to give you guys 3-ish exercises to go through, and you can practice them here. I will also say that at our clinic on Wednesday, this coming Wednesday at 1 o'clock, I'm kind of doing a similar presentation, and we'll be walking through these exercises in person. So if you want a little bit more attention to make sure that you're doing them correctly, or just to kind of, get some in-person attention, you can come in at 1 o'clock, and I'll talk about that at the end. So, just as I said, with what arthritis is, how the cartilage gets its nutrients is from motion. So I like to say, motion is lotion. I say that a lot. Motion is lotion. Morgan's nodding her head because she's seen all of my workshops. Motion is lotion. So riding a bike, I think, is a great way to get some flexion and extension into your knee. If it hurts to go all the way around, what you can do is kind of arc back and forth instead of going into a full pedaling motion. So biking, swimming, walking, anything that's going to get your knee moving. Typically, those that have knee osteoarthritis have limited extension, so they have limited motion in straightening their knee. So that's what we're going to work on right now. So if everyone can scoot to the edge of their chair, and I'm going to slide this back a little bit. Let's use this leg. So we're going to do a quad set. So we're going to squeeze our quad, and what that's going to do is straighten the knee back. So like I said, if everyone can scoot to the edge of their chair, sit up on your sit bones. If you haven't done my posture workshop yet, make sure to join that. But I teach you how to sit. Don't be schlumpy like this in your seat, but kind of up on your sit bones. And then with your leg all the way straight out, you are going to squeeze your quad, or squeeze your thigh muscle, which is going to lift your kneecap. And you might feel a little bit of a stretch in the back of your leg. Hold this contraction for 5 to 10 seconds, and then relax, and then go again. Especially with those, who are going through, or if you work a lot in the day, so if you're always sitting at your desk, this is a good one to do, just because it's sitting. So the other one that will also help contract your muscles, and I forgot to mention that these contractions are isometric contractions, and they actually have an analgesic effect. And so when I say analgesic, that just means pain relieving. So doing these gentle contractions could also help with pain if you are unable to take ibuprofen or Tylenol, or if you're tired of taking ibuprofen and Tylenol. Doing some light isometrics will help with pain. So the second one is a hamstring isometric. So with your knee bent now, same position where you're sitting on the edge of your chair, I'm digging my heel down into the ground, almost like if I was in sand and I'm trying to scoop the sand underneath me. I'm pulling in, and you should feel the back of your leg contract, your hamstring, holding, and then relax. Pull back and squeeze. Does anyone have any questions about these? And relax. Pull back and squeeze. And let go. Okay. That is, I'd say that's for my mobility. Or that's what I'll give you guys for mobility for right now. I mean, there's a lot of, does anyone have a question? No. Lost my train of thought. Strengthening, as I mentioned before, making sure that you're targeting your quads, definitely for the strength of the knee. But the other thing that I think is really important that is underutilized are your glutes. This goes back to earlier when I was showing you how if your hips are weak, or how you get a funky position in with your knee, that can be contributed to the strength of your hips. So making sure that your hips, specifically your glutes, are strong, so that can keep your leg in a good position, so that the alignment of your knee is correct. I'm not going to give an exercise for that just because that's going to involve a little bit more things. But there's a lot of things we can do for your glutes. And nothing is really cookie cutter. I mean, anyone can just look online and say like glute exercises or quad exercises. But if you're not doing things that are proper for your body, or if you have pain doing those exercises, then it's not going to benefit you. But there's a lot of different ways that we can strengthen, so that's kind of my job to figure out, okay, what exercise works best for your body. And then the last thing that I have on my agenda is motor control. So we strengthen our muscles, but the other key is that we want to make sure all of our muscles work together and are coordinated. So just the strength of something isn't necessarily going to get the job done, but we want to make sure that the muscle turns on at the right time. And this is with more complicated exercises like squatting or lunging or doing stairs. But that's what we will kind of go over in Wednesday's workshop in person. Does anybody have any questions? Please have questions.
Do you see the question in the chat?
Oops. On the first stretch, do you point your foot? You don't have to. Whichever position is most comfortable for your leg. It depends. I would say, here, I'll do this foot so you can see my foot. My foot is just relaxed. I would say it doesn't matter. For now, it doesn't matter. If anything, just keep your foot relaxed. If you bring your toes up, you might feel a little bit more of a stretch, and that's just some nerve tension, which is okay as long as you don't have nerve problems. How do you know if you have a nerve problem? You come see me.
How do I know when I should come to physical therapy?
Thank you. Someone just in my room asked when to come to physical therapy. I always like to say, or I have people, no one wants to come to physical therapy, which hurts my feelings. But if aches and pains are normal. I mean, I sprained my ankle last week, or like sometimes I have some back aches. But if it's something that every time that you go on a longer walk, or every time that you put up Christmas lights every year, or every time that you put the Christmas lights away, if something consistently bothers you, it's not just going to go away. So I would rather see you sooner rather than later. And that's honestly, if you listen to, or on our Facebook page, we have a lot of testimonials of our clients, and the majority of them will always say, like, I wish I came to physical therapy sooner. So the quicker we can address the issue, the less likely, or just the less it's going to progress and get worse. So there's always something that we can try to do. So when to come to physical therapy, if it continues to irritate you, come see me. And then how to come see a physical therapist. We do cash pay, meaning we wouldn't have to have a physician's referral. And I can see you for that for 2 weeks. But it's really easy to get a referral from either your primary care or a specialist. The other thing that I think is annoying, even if you go see your doctor and they say, well, let's send you to a specialist, or let's get an image, or let's get an MRI first, we can still start therapy, and you don't have to keep staying in pain until you go through all these different steps. So sooner rather than later to come see me. What other questions? There's a lot of you here. Or does anyone have any specific times when you have pain in your knees?
I have a question. First, let me say thank you so much for this presentation.
Oh, you're welcome.
Which is quite interesting and very useful. I think all of us who have knee pain benefited from the different factors that you've outlined there.
Good.
I've had knee pain for quite a few years, probably a result of accidents and other things as well as age. I lived for a while in New Mexico, which was so dry that I had very little knee pain. But now I'm back in Texas, and here it's a little bit more humid, and the knee pain has started again. I've wondered at what point I need to go in and see a specialist about it. My concern being that they may find that the easy solution is just replace the knee and move on. Whereas my own inclination is to see everything short of replacing the knee. Eventually I'll have to get my knee replaced. But I'm a little bit nervous about going in and the doctor saying, yeah, this is your one candidate for a knee replacement. Let's just go ahead and start scheduling that. How do we know as a patient when it's time to go in and take that risk that the doctor is going to say, let's just go ahead and do that now?
Yeah. That's a good question. And something that I think is, if you go in to see a surgeon, they're going to recommend surgery. Just like if you come to a physical therapist, we're going to recommend physical therapy. So in terms of when, same thing as if it's consistently bothering you, start to take action just because it's not going to go away. So at least they might want to get an x-ray just to see with how far it has progressed, which is okay. But as I mentioned, it's important to, those that have good outcomes after having a total knee replacement, those individuals have stronger quads before surgery. So if we can strengthen you beforehand, which also might just take your pain away, or not take your pain away, but make it more manageable, I think that would be a better time, or that's a better sequence of things, of coming to physical therapy for a couple times, having prehab, as opposed to post surgery. But when to go see a specialist or when to see a physical therapist is if it's continuously bothering you. And sometimes that I see what happens a lot is that if you're walking on a really painful knee, then your body starts to develop compensations, and then other things start to have extra pressure on them that then makes those parts cranky. So a lot of back problems, or their other hip starts to hurt, or their other knee starts to hurt because they're putting more pressure on it and they're favoring the other side. So if it's bothering you, go take care of it. And you can always say no, or you can always say that you want to do the conservative approach first. And there's nothing wrong with that. Good question. Thank you. Something that I did not mention.
I have a question.
Go ahead.
If we are referred by our primary care, is this covered by the insurance?
Yes. So we take Medicare, Blue Cross, we take a bunch of insurances. So it depends specifically. If you would like to know whether or not we take your insurance, you could call our office. But yes, we take most major insurances.
And you said you do take Medicare. Okay.
Yes. Yep.
Thank you.
Something that I did not mention in the beginning, which is a hallmark of knee osteoarthritis, is mostly stiffness in the morning. So going back to how the cartilage gets its nutrients through that diffusion, motion is lotion, because we don't move in our sleep and we're just still for a long time, a hallmark sign of someone that has knee osteoarthritis is that stiffness and pain after being sedentary for a long time that then improves as you start to move around. Just something that popped into my head that I wanted to mention.
I have one more question for you. Do you recommend anything like glucosamine or fish tablets?
Oh, I forgot to mention that. So the research support, as of now, glucosamine or any supplements don't have any significant improvement, or there's no evidence to support it. But there's no harm in it as long as it's not influencing whatever else you're taking, which you would ask your pharmacist. But there's no harm in trying. But as of right now, the research doesn't support it. And then something else with all just supplements is just making sure that you kind of have to be consistent with it. But diet definitely influences, just as whoever asked the question earlier, how the weather can influence our bodies, what we put into our bodies, and if we're well hydrated or if we're eating a lot of foods that are maybe inflammatory inducing. So if you're eating a lot of processed foods or not getting enough sleep, that's going to just cause a lot more irritation just in your body and in your pain receptors. So just being consistent with supplements and then also diet is key. Our whole bodies need to be treated.
Thank you.
Mm-hmm. Anything else? No? Okie dokie. Am I doing a workshop next week? When's my posture? Next month. Yeah.
Monday is vertigo and dizziness.
Yeah. So my my coworker Zoe will be doing a workshop next week. I do a workshop on posture. That's next month. I don't have the date, but just keep an eye out on the Lake Travis Library. Also, our Facebook page lets you know when all of those are available, so you can find our Facebook page and get updates from that. But I appreciate. Yeah.
You would say the word posture, and it makes me sit up straight. Just like this. It makes sense. Posture.
I know. Well, yeah, we'll talk about that. Thank you guys for joining me today. I appreciate you. I appreciate your time.
Thank you.
Thanks so much, Cassie. Thank you.
Yeah, you're welcome.
Thank you.
Bye.
Bye.